What kinds of situations would you recommend a lip lift other than just to volumize the lip? When
So,
would you say, okay, this is a good time to do it? And also, for instance, after a nose job or
mhm,
rhinoplasty, it may be indicated. Correct?
correct. Yeah. Yeah. So, I mean, there are situations like that where you have either orthodontic surgery, meaning jaw surgery, or rhinoplasty, and that can change the laxity of the lip and the position of the upper lip where it sits for many reasons. That I've seen. I was doing a survey for a couple months, but I lost track of it to see how many of the patients coming in for lip lifts had prior rhinoplasty and if they think it was caused by that. Orthodontic surgery, you certainly see caused that. The main indication, so I'd say the most clear indication that I see for many patients is just lack of tooth show. So they have poor incisive display, you don't see the teeth. And that's why you get a lot of referrals from dentists where instead of lengthening the teeth and making the face longer, they say, okay, let me treat the soft tissue component of this, get rid of the hooding of the curtain in front of the teeth, and then now I can keep the teeth looking delicate and appropriate for the rest of the face. The reason we like to have incisive display is that it portrays youth, it portrays sensuality, and I'd say an appropriate brightness to the face, and as well as an important skeletal soft tissue balance to the face. So we look at soft tissue and skeleton on the face, and teeth kind of are part of the skeletal appearance of the face. So you want someone balanced. You want to have some skeleton appearance, meaning you would have accented cheeks, noticeable teeth, those parts, and you don't want too much where they look skeletonized. So you need a nice balance between these soft tissues and the teeth itself. And in addition to that, you don't want to look at somebody and just see darkness. There are two areas on the face that you see brightness, and that's in the eyes and the teeth.
I see. I see.
So when it's covered, people tend to have the appearance of being senile, meaning being older. So they get
Okay.
the senile upper lip, the droopy upper lip. So the darkness is not sexy and it doesn't look young.
Okay. Does that apply to men and women?
Both, yes, yes.
It
For
does.
men especially, men
Yeah.
do get long hooded upper lips, and they lose their sexuality. And
Hmm.
men, don't look at that. But certainly, I do see a lot of men that I see, and they just look older because of this. And you end up doing a lip lift on them, and they look younger immediately, even when they're swollen. And it's not
Wow.
a sexy appearing lip when they're swollen, but they still look younger.
Wow. So you've done a number of men.
Yeah, yeah,
Hmm.
yeah, tons.
Oh, okay. Okay. I
Yeah, and
didn't.
they actually hide it better initially because the swelling for these kind of procedures can go up to 3 months.
Yeah.
And guys, after 2 weeks, they have some facial hair on it. You can't even tell.
Well, first of all, can you describe your surgery before we describe what it looks like afterwards?
Sure.
Can you tell me in simple terms what do you do surgically?
Okay. So the type of lip lift, we call it a modified upper lip lift, which refers to a deep plane lip lift. If you were to try to
Is this is
classify it
is
as,
this called a Tillet modified upper lip?
yeah, I haven't put my name on it, but
Oh, you have a
but
patent on this one, or
no, no, I teach it to everybody. So it's
okay, okay.
but the type of lip lift, the modified upper lip lift, refers to a deep plane release with a secure suspension, which means um, we follow the classic bull's horn incision, which means we make the incision at the junction of the lip and the nose. So you want to leave the units on the face separate. You never want to join two units, meaning you don't want to attach the cheek to the nose. You don't want to put the lip inside the nose. You don't want to do anything like that. The nose stays the nose. The lip stays the lip.
Hmm.
In order to achieve that, you can't cross that boundary. You have to maintain the incision in the natural crease. I don't make a limited incision because limited incisions, meaning shorter ones, scar worse because there's more tension, there's more tethering, so they actually scar worse. The longer incision heals better within the
Okay.
natural crease, meaning I also don't extend it laterally where there's no crease if somebody doesn't have a crease. So you stop it wherever the crease stops. But
Okay.
that's the crease right there at the base of the nose. And we use that crease to design an excision, meaning an area that we cut out of upper lip skin. We remove excess skin that's going to be right here at the base of the nose, release everything in a deep plane, meaning under the SMAS and above the muscle between those two layers, which allows you to redistribute the skin evenly and without tension. And we secure the SMAS, which is that deeper layer under the skin, up to the piriform ligament, which is a series of uh, dense ligaments above the periosteum or the bone on the nose. And we just close it up like that. And people end up getting a lift out of it, which means they get a shorter upper lip. It sits in a higher position.
Hmm.
It lifts the corners as well, revealing them, which is different than other lip lifts. It gives more tooth show, more accent, and more volume show, which means you're not increasing somebody's volume, you're not adding anything to their face, but you are increasing the vermilion show. So you're increasing their apparent volume, what you're actually seeing. So it's buried before the red part of the lip, and then it lifts up, so you're seeing the front wall of the lip now. So it does look like patients have more volume afterwards, even though you haven't added anything.
Right.
The healing for something like this, it's a 20-minute procedure. It's I tell people it's 45 minutes because it takes about 20 minutes to let them numb and then 20 minutes to do the procedure. They go home with stitches. We take out at day 3 and day 5.
Mm.
Typically, at a week, they look gigantic. It looks like a huge upper lip, which is very different than other lip lifts. Other lip lifts, where you're not really doing much work internally, they heal very fast. However, it doesn't last very long. It's not a big lift. You can cause scarring on a large majority of patients and effacement of the nasal base, widening, loss of structure. So a lot of bad things can happen, but they do have a fast recovery. Uh, in those cases, I think fast recoveries don't benefit you because you've just screwed someone for life. So who
Yeah.
cares if you healed in a week? The rest of your life, you're going to have a bad outcome.
Right.
So I do see a big benefit in doing this kind of lip lift, regardless of the sacrifice that we take for the recovery time. And the recovery time itself does go up to 3 months, which in my mind does benefit the healing of the scar because the swelling limits the motion on the upper lip. And having
Oh.
that decreased dynamic movement does help the incision heal better. So there is a benefit to it. But I tell patients that a week you're going to look huge. At 2 weeks, you look less huge. At 3 weeks, you're going to look what we call passable, which means you can go out in public and 9 out of 10 people won't realize you did anything. 1 out of 10 is going to be your friend, and they will realize you did something because it looks off. At 2 months, you're
Yeah.
looking pretty good, and you just have swelling left up here in the upper lip. Usually on one side, you have a bump that's just muscular induration or muscle thickness. By
Mm.
3 months, you look perfect. You're only about 20% healed, but you're perfect looking. And the healing for any kind of paper cut, usually at a year, is 80% healed. At 3 years is 95% healed. So that applies to a lip lift or facelift or anything like that as well.